Gentlemen, if you're a man over 60 and you're looking to significantly boost your erectile strength and overall male vitality, listen closely. As a urologist, I'm about to reveal a simple 3-minute daily exercise that can genuinely help you reclaim that confidence and vigor. This isn't about quick fixes or magic pills. It's about a proven science-backed approach. So, stay right there. I'm Dr. Lauren Hart. Here on my channel, we dive into practical, science-backed ways to help you maintain and improve your intimate health for years to come. After many years as a urologist, I've learned that a man's confidence is deeply tied to his overall well-being, and sexual health is a major part of that. It's completely normal to notice changes in erectile function as we age. And let's be honest, many men feel a sense of frustration, even embarrassment when these changes occur. But I want to reassure you, you are not alone. And there are concrete, effective steps you can take. You see, factors like blood pressure, diabetes, cardiovascular health, even stress and certain medications can all play a significant role in erectile function. It's a complex interplay of your vascular system, to introduce you to a foundational element of male pelvic health that often gets overlooked, your pelvic floor muscles. Think of them as the unsung heroes supporting your bladder, bowel, and yes, even your erectile function. Strengthening these muscles through targeted simple exercises can lead to remarkable improvements in blood flow, nerve function, and overall erectile quality. This isn't about anatomical size, folks, which isn't achievable through exercise, but about maximizing the health and performance you already have, ensuring those vital systems are working at their absolute best. So, let's get right to it. The exercise I'm talking about is commonly known as a Kegel exercise. For years, Kegels were primarily associated with women, particularly after childbirth. But men, I cannot stress enough how absolutely vital they are for your health too, especially for issues like urinary control, prostate health, and as we're discussing today, erectile strength. 1. Identifying the pelvic floor muscles. Crucial first step. The first step is to correctly identify these muscles. This is crucial because if you're using the wrong muscles, you won't get the benefits. It's simpler than you think. Imagine you're trying to stop the flow of urine midstream, or you're trying to prevent passing gas. The muscles you clench and lift are your pelvic floor muscles. They run from your pubic bone to your tailbone. A common mistake here is to tense your abdominal, thigh, or buttock muscles. Don't do that. It's a subtle internal squeeze, an upward lifting sensation. You can try this while sitting, lying down, or even standing. Once you've found them and feel confident you're isolating them, you're ready to start. The 3-minute daily pelvic floor exercise routine. The 3-minute daily routine consistency is key. This routine is designed to be quick, easy to integrate into your day, and incredibly effective. Aim for 3 minutes once a day. You can do it anywhere, at your desk, in your car, while watching TV. The key is consistency. Like any muscle, your pelvic floor needs regular exercise to get stronger and function optimally. Step 1. The slow hold. 1 minute. We begin with what I call the slow hold. 1. Gently contract your pelvic floor muscles, lifting them upwards. 2. Hold that contraction for 3 to 5 seconds. Really feel that squeeze. 3. Then, and this is critical, relax completely for the same amount of time. Don't rush the relaxation. That full release is just as important as the contraction for proper blood flow and muscle recovery. 4. Repeat this 10 to 12 times. This step builds endurance and control. Step 2. The quick flick. 1 minute. Next is the quick flick. This is about speed and responsiveness. 1. Rapidly contract and relax your pelvic floor muscles. 2. Think of it as a quick flutter or a series of rapid lifts, almost like a light switch quickly turning on and off. 3. Do this for about 1 minute, focusing on the quick contraction and ensuring a full rapid release after each squeeze. This helps with the quick reflexes needed for firm erections. Step 3. The endurance hold. 1 minute. Finally, the endurance hold. This helps build stamina for sustained function. 1. Contract your pelvic floor muscles and hold for as long as you comfortably can without holding your breath. 2. Aim for 10 to 15 seconds initially and gradually increase as you get stronger. 3. Then again, fully relax. 4. Repeat this 3 to 4 times. This truly strengthens the muscles for more lasting effects. That's it. 3 minutes every day. It sounds simple, and it is, but its power lies in its consistency and correct execution. The science behind stronger erections and male vitality. Now, let's talk about the why. How exactly does this help your erectile strength and vitality? It's all about optimizing blood flow, nerve health, and venous occlusion. When your pelvic floor muscles, specifically the bulbocavernosus and ischiocavernosus muscles, are strong and well-toned, they act like a powerful pump. During an erection, blood rushes into the spongy tissues of the penis. For a truly firm erection, this blood needs to be trapped there. Your pelvic floor muscles play a critical role in compressing the veins that allow blood to leave the penis. This is called venous occlusion, and it's essential for maintaining firmness and duration. A stronger pelvic floor means a more effective blood trap, leading to significantly improved firmness and the ability to sustain an erection. It's like building a stronger foundation for a house. Everything on top performs better with more stability and rigidity. Furthermore, these exercises improve nerve sensitivity and coordination in the pelvic region. Think of it like fine-tuning an instrument. Better nerve function means better sensation, better control, and a more responsive, robust erection when you need it. This can translate into not just firmness, but also improved climax and overall sexual satisfaction. While we're not talking about anatomical size increase, which isn't achievable through exercise, the improved blood flow, enhanced firmness, and better control can certainly lead to a fuller, more optimal erection, one that feels more substantial and performs better. It's about getting the most out of what nature gave you by keeping those essential systems working at their peak. And the benefits extend beyond just erections. Strong pelvic floor muscles also contribute to better bladder control, helping with issues like dribbling after urination or urgency. They can even significantly help with premature ejaculation issues by giving you more control over the ejaculatory process. So it's truly a holistic win for men's overall health and well-being. Mistakes to avoid and red flags to watch. And while these exercises are simple, it's easy to make a few common mistakes that can diminish their effectiveness or even cause strain. Mistake 1. Bearing down. Don't push down. You're trying to lift and squeeze upwards, not strain downwards. This is a common error and can actually weaken the muscles or cause other issues. Mistakes to avoid and red flags to watch. And while these exercises are simple, it's easy to make a few common mistakes that can diminish their effectiveness or even cause strain. Mistake 1. Bearing down. Don't push down. You're trying to lift and squeeze upwards, not strain downwards. This is a common error and can actually weaken the muscles or cause other issues. Mistake 4. Overdoing it. More is not always better, especially when starting. Stick to the 3-minute routine daily. Overtraining can lead to muscle fatigue or pain. Crucial non-negotiable point: seek professional help. And finally, a crucial non-negotiable point. While Kegels are incredibly beneficial and a fantastic tool for preventative and supportive health, they're not a magic bullet for every issue. If you're experiencing persistent erectile difficulties, severe urinary problems, pain during erections, or any discomfort in your pelvic region, it's absolutely essential to consult your doctor or a urologist immediately. There could be underlying health conditions like heart disease, diabetes, nerve damage, hormonal imbalances, or even prostate issues that need professional medical attention. Self-treating these conditions can be dangerous, Early diagnosis and treatment are always your best course of action for optimal long-term health. Don't hesitate to seek that professional opinion. Final tips and lifestyle integration. Gentlemen, taking control of your health, even the parts we don't always talk about openly, is a true sign of strength and self-respect. This 3-minute daily routine is a simple yet incredibly powerful way to invest in your long-term erectile strength, vitality, and overall well-being. It's about building a foundational health habit that empowers you in all areas of life, enhancing your confidence and intimate relationships. Remember, these exercises work best as part of a holistic approach to health. Combine them with a balanced diet, regular cardiovascular exercise, good sleep, and stress management techniques. Think of it as equipping your body with all the tools it needs to perform at its peak. If this conversation today has empowered you and you're ready to take even more proactive steps for your men's health, here's how you can keep this momentum going. Hit that like button right now. Subscribe to Dr. Lauren Hart's channel and turn on the bell so you never miss practical science-backed tips specifically for men's health after 60. Drop your questions or comments below. I read every single one, and your insights often inspire future videos. What other topics about men's health would you like me to cover? Thank you so much for watching today. In my very next video, I'll be tackling another vital topic, navigating prostate health. When should you get screened and why it matters? We're going to dive into the latest guidelines, common misconceptions, and what every man needs to know to protect his prostate. You absolutely won't want to miss that one. Stay informed, stay healthy, and keep taking charge of your well-being. We look forward to seeing you in the next.